Okay, everyone. My name is Dr. Sandeep Gupta, and welcome to the May 2026 webinar for Lotus Holistic Medicine. And our topic today is going to be hormones for women in the midlife. And so we've got Julie Farrelly, who's a nurse practitioner with us today, and also Anna Plešec, who's a nutritionist and health coach. How are you guys today?
We are great, good, and excited.
Excellent. Well, without further ado, I'll pass over to our first speaker, which is Julie. And we've already got her presentation ready to go.
You're already looking at that. Hi, well, welcome everybody, and thank you for joining us for this webinar. So my presentation is titled The Hormone Connection, How to Thrive in Midlife with More Energy, Focus and Confidence. And I'm so excited to spend this evening with you sharing insights and strategies to help you feel vibrant, confident and in control during this transformative phase of life. So whether you're here to learn more for yourself or for a loved one, or even for a patient if you're in healthcare yourself already, I'm honoured to share this time with you. And for those who don't know me yet, I'm Julie Farrelly. As Sandeep said, I'm a functional and integrative medicine nurse practitioner with advanced training in nutritional and environmental medicine and Bioi-dentical hormone replacement therapy. And so over the years, I've worked with many women who've struggled with low mood, fatigue, weight gain, and countless other frustrating symptoms that often accompany menopause and perimenopause. But of course, this isn't just my professional passion. I've walked through this path myself, obviously, now being 61. Having gone through perimenopause and beyond, I know how overwhelming and isolating it can feel when solutions just seem so out of reach. So my mission is to provide women with practical tools and science-backed strategies to not only manage your symptoms, but to truly thrive in midlife and beyond. So I want to start here because this is often the most frustrating part for women. If you're doing all the things you've been always been told to do, so you're already eating really well, you're exercising, you're showing up in your business or your career or your home life, and you're trying to stay productive and positive, and yet something just feels different. And often women just can't quite explain it initially. They just know that they don't have the same energy, the same clarity, or the same resilience that they used to have. And because many women at this stage of life are naturally high functioning, we're sort of higher up in our careers at this stage of life for really managing busy households and quite responsible, we just tend to blame ourselves first. And women may think, maybe I'm just not being disciplined enough anymore. Maybe I'm just stressed. Maybe I need to try harder. But what I really want women to understand is that often this is deeply physiological. So these symptoms can show up in many different ways, and sometimes it's brain fog. And usually when I say that word, people just nod and yeah, I get what that means. Or they say things like, I lose my train of thought, I walk into a room and forget why I'm there, can't think as sharply as I used to. And then sometimes it's sleep, like waking up at 2 or 3 in the morning, unable to get back to sleep and the mind really busy, and then trying to function at work or at home the next day while just being exhausted. And sometimes it's emotional resilience. Women who used to cope beautifully suddenly feel more overwhelmed and reactive or emotionally just flat, just meh. And then there are those body changes. So weight gain is very common, reduced recovery, increased stiffness, that just sore all over feeling and just really fatigued. And what's important is that those symptoms are often interconnected. And this is the part we don't talk about enough. These hormonal shifts just don't affect women at home, and they absolutely affect women in busy household situations or leadership roles in the workplace. And because when your physiology changes, it changes how you think and how you respond to stress, how you recover, and how much energy you have available each day. And of course, that can affect your confidence, your productivity, communication with others, decision making, and creativity. And I think many women quietly fear that they're just losing their capability, when in reality, their body simply needs a different strategy. And one of the most common things that women say to me is, I just feel like I've lost my edge. And that can feel incredibly confronting, especially for women who are used to being capable and high performing. And sometimes they feel guilty because they think they should be coping better. And sometimes they worry that they're becoming less effective professionally. And sometimes they start withdrawing a little socially or professionally because they don't feel like themselves anymore. Some women will drop back to part-time work, or they'll stop going out and meeting their friends for coffee, which is really sad. And so if any of this resonates with you today, I really want to know that you're not alone in it. And this is probably one of the most important slides in the entire presentation. This is not a lack of self-discipline, because the women that I work with are usually already highly disciplined. It isn't laziness, it isn't weakness, it isn't failure. It's often a physiological transition that requires a new understanding and a new approach. So today my goal is really to bring clarity and reassurance, and we're going to talk about what's happening hormonally in midlife and why the old wellness advice often stops working, and how exercise and recovery need to change. Midlife is often presented as though it's just about periods stopping or hot flushes happening. So that's the classic, here we are in menopause type symptoms. But physiologically, it's much bigger than that. This transition affects the brain, the nervous system, metabolism, muscles, bones, inflammation, and recovery. And this is why women often say, so why does everything suddenly feel harder? Because multiple systems are shifting simultaneously. There are 3 key hormones that I want you to understand today. So estrogen is one we all know about. Everyone hears all about estrogen. Then there's progesterone, and then there's the forgotten hormone in women, testosterone, we just don't talk about enough. And although we often associate these hormones purely with reproduction, they influence so much more than that. So they affect brain chemistry, sleep, motivation, metabolism, stress resilience, muscle maintenance. And so when they shift, women can feel it in every area of their lives. So estrogen is incredibly important for the brain. It supports our neurotransmitters, which are messenger chemicals, like serotonin and dopamine, which influence mood, motivation, and mental clarity. And it also supports memory, temperature regulation, and sleep quality. So when estrogen starts fluctuating and declining during perimenopause and menopause, women often notice that brain fog, the forgetfulness, reduced sharpness, reduced confidence mentally. And often this can be particularly distressing for women with busy lives because their cognitive performance matters so much to them. Progesterone is often what I call the calming hormone. So that it supports sleep, nervous system regulation, and emotional steadiness. And progesterone is actually the first hormone to start declining in perimenopause. So women can start experiencing lighter sleep, increased anxiety, feeling more wired, and they have reduced stress tolerance. And many women think, why can't I just cope the way I used to? And again, this is often physiological. And then testosterone is another really important hormone for women that we don't talk about enough. It influences motivation, confidence, initiative, muscle mass, libido is the big one that we all know about, and then follow through. So when testosterone is lower, women often describe, I just can't get going. And not because they don't care, but because the internal drive feels different. And then metabolism also changes significantly in midlife. So we see the reduced insulin sensitivity, which can lead to a bit of weight gain, easier fat storage, accelerated muscle loss, and lower energy expenditure. And research shows that women may burn around 200 fewer calories per day in menopause, even doing the same activities. So that's not very nice. And so many women are still trying to do the old strategy, so eat less and exercise more, but physiologically the body is becoming more protective and stress sensitive. This is a really important conversation. Menopause status is now considered one of the strongest predictors of muscle loss, stronger than age itself. And muscle is not just about aesthetics, which means, just looking good. Muscle supports. Flip back to there. What did I miss there? Muscle supports metabolism. We were talking about that before, the insulin sensitivity. So how well your bodies can suck up that glucose out of the bloodstream and use it effectively. At bone health, resilience, longevity, energy capacity. And so preserving muscle in midlife becomes incredibly important for long-term health and quality of life in general. So when you put all of this together, it suddenly makes sense why things feel different. And it's not random, and it's not because women are failing. It's because physiology is changing, and women need strategies that actually reflect that reality. So what do most women do when they start feeling these changes? Usually they just try harder. It's just how we're conditioned. So they might eat less, exercise more, push through that fatigue, drink more coffee, ignore symptoms, keep telling themselves that they just need to get more organised or motivated again. And this is especially common in high-performing women because pushing through has often worked for them in the past. But midlife is the stage where the old strategies often stop working. And this is the key issue. Many women are still applying strategies designed for younger physiology to a body that now has different hormonal and metabolic needs. And the result is often, so you're more exhausted, you're more frustrated, more self-blame, and the body isn't responding the way it used to because the body itself has changed. And this is where I think the conversation around hormone therapy can become oversimplified. Hormones absolutely matter and they can make a profound difference for many women, but of course they're not the entire story. So when I work with women, I'm looking at sleep quality, stress load, nervous system health, metabolic health, inflammation and recovery capacity, because hormones sit on top of physiology. And if the foundation underneath isn't supported properly, then women often don't get the full benefit from the hormones. And one of the biggest misconceptions is that hormone therapy is just one thing. Women will often say, I tried HRT or MHT and it didn't work for me. But hormone therapy is incredibly nuanced. What matters is the type of hormone, the dose, the delivery method, the timing, the individual women's physiology, and because bodies respond differently. And when hormone therapy is done thoughtfully and individually, the outcomes can be very different. And this is a section that I'm really passionate about because exercise advice for menopausal women is often outdated and incredibly frustrating. Many women are still being told, just exercise more. But what kind of exercise and at what intensity, with what recovery? That matters enormously in midlife. And many women are unknowingly using exercise in a way that actually increases their physiological stress rather than supporting resilience. And that doesn't mean that cardio is bad, but long duration, high volume exercise, especially combined with stress and poor sleep and underfueling, can become problematic for women in menopause because cortisol is designed to rise during exercise. That's normal. But with prolonged endurance exercise, cortisol can remain elevated without an appropriate reduction afterwards. And that's what many people notice. They feel more exhausted, more inflamed, less recovered, and sometimes even gain weight despite exercising harder, which feels incredibly confusing. And one of the most important concepts that I want women to understand is this. Many women in midlife are not over-exercising, but they're under-recovering. Recovery requirements change in menopause. Joints, connective tissue, ligaments, tendons, nervous system function, All of these become more sensitive to stress and require more recovery support, and sleep becomes absolutely critical. So instead of thinking I need to train harder, the better question may be, am I recovering well enough for the life that I'm trying to live in currently? And this is where resistance training becomes incredibly powerful for women in midlife. Resistance training is not just about appearance or aesthetics. It supports muscle preservation, metabolic health, insulin sensitivity, bone density, strength, confidence, and long-term independence. And one of the biggest concerns we have in menopause is accelerated muscle and bone loss. So strength training becomes protective medicine. And the research is really clear here. The best outcomes for bone density and musculoskeletal health appear to come from hormone therapy plus resistance training together. And interestingly, resistance training alone often performs better than hormone therapy alone when it comes to bone support. So movement matters enormously. Exercise is not optional for healthy aging, but the type, volume, and recovery strategy matter more than ever. Now, I really want to connect this back to you and your life stage, because muscle and movement are not just aesthetic conversations. Muscle influences energy capacity, stress resilience, cognitive performance, yes, even your brain, metabolic stability, and independence later in life. And even if you're thinking about, traveling in the future, just the simple things. Think about things like if you're traveling on a plane, having to heave up your bag into the overhead compartments, just things like that are really crucial for us to, be able to maintain that independence. And women in midlife need sustainable energy, not just motivation, but actual physiological capacity. Many high-performing women are incredibly good at overriding their body's signals. They can ignore the fatigue, keep going when exhausted, they normalise poor sleep, they train throughout burnout and use caffeine to compensate, until eventually the body pushes back. And often this is the stage where women suddenly realise, I just can't do this the same way anymore. So midlife often requires a shift in strategy. Not less ambition, not less success, but more intelligent support. And that means better recovery, smarter exercise, improved boundaries. Boundaries is a big one in our stage of life. Prioritising sleep, regulating stress, supporting physiology instead of constantly fighting it. And one thing that I found fascinating in the newer menopause research, exercise research, is the focus on mobility, stability, and agility, not just calorie burning. Because women don't just lose muscle, we also lose joint resilience, the fast twitch muscle fibers, and mobility and reaction speed. And this influences our injury risk, our balance, independence, confidence in movement. And so movement in menopause becomes about longevity and not just quality of life, not punishment. And here's the really encouraging part. Women can absolutely build muscle and strength at any age, even post-menopause and without hormone therapy, well into older age. And some studies have shown that women in their 80s making extraordinary strength gains. So it's never too late and the body remains adaptable. And this is another really important mindset shift. More is not always better in menopause. So the newer American College of Sports Medicine, I know that's American, but our guidelines have taken this on board. The guidance is actually moving back towards simpler, more achievable exercise recommendations, because the old recommendations were often overwhelming and unsustainable. And interestingly, 2 resistance sessions per week may be just as effective as 3 for many women, which is incredibly reassuring for busy women who already feel very stretched. So the goal of exercise in menopause should not be exhaustion. The goal is strength, resilience, energy, confidence, longevity, and capacity. Exercise should leave women feeling stronger over time, not progressively depleted. So let's come back now to the hormone therapy itself, because this is where there's often so much fear and confusion. And I think one of the most important reframes is this. Hormone therapy is not about trying to artificially create a younger body. It's about supporting a changing physiology. It's about restoring balance and improving quality of life where appropriate. And for many women, that can be incredibly transformative. When hormone therapy is prescribed appropriately and tailored properly, it can support sleep, mood, brain clarity, those hot flushes should go, energy, libido, joint comfort, and overall quality of life. And one thing I really want women to understand is that symptoms are not just in your head. There are real physiological reasons why women can feel so different during this stage of life. And modern menopause care is very different from what many women think of when they hear the term HRT. And we now have better research, more individualised approaches, better understanding of risk profiles, more options for delivery methods and formulations. And thankfully, menopause medicine is continuing to evolve, which is important because women deserve evidence-based, nuanced care rather than fear-based messaging. And this is where balanced education matters so much, because many women have heard very frightening statements around hormone therapy. Things like it causes cancer, it's dangerous, it's unnatural. But health decisions should never be based on fear alone. They should be based on context, evidence, individual risk factors, quality conversations, informed consent. And unfortunately, many women have never had the opportunity to receive that kind of balanced discussion. One of the things I feel most strongly about is that women deserve to feel heard during this stage of life. Good menopause care should never feel rushed or dismissive, and it certainly shouldn't be, oh, you're just getting older, just deal with it, because every woman is different. They've got different symptoms, different stress loads, different physiology, and different goals. So the approach should always be individualised. And ultimately, this conversation is not really about anti-aging. It's about helping women feel clear, strong, capable, resilient, mentally sharp, and emotionally steady. It's about quality of life and helping women continue to show up in their careers, their relationships, and lives in a way that feels sustainable and aligned. And if there's one major mindset shift that I'd love women to take away today, it's this. Your body is not broken, your body is adapting, and often it's asking for a different support, different recovery, different nourishment, different expectations, and a different strategy than what worked at age 25 or 35. I truly believe midlife can be one of the most powerful stages of a woman's life, not because it's always easy, but because it often becomes a stage where women finally begin listening to themselves differently, where they stop constantly overriding their body, where they become more intentional, more aware, more selective with their energy, and sometimes more confident than ever before. So I want to leave you with this today. You deserve to feel energised, mentally clear, strong, confident, and supported, not just in your career and in your home life, but in your body as well. And if you've been feeling different lately, please know you're not imagining it, you're not failing, and you do not simply have to push through it alone. So thank you so much for being here today. And if you're ready to take control of your health and feel like yourself again, of course, I'd love to work with you. And you can book your appointment with me through Lotus Holistic Medicine. In our first session, we'll have a detailed discussion about your symptoms and your concerns. And I also provide you with a request form to go and get comprehensive blood testing done so that we can gather all of the information that we need to personalise your care. But here's the good news. You don't need to wait for your blood results for us to start you on HRT straight away. A thorough symptom analysis is enough for me to begin treatment and help you feel better sooner. And together we can create a tailored plan for your needs, and I'll be with you every step of the way. And I usually supply with loads of reading material and, recommended books and podcasts to listen to. And there you go. Thanks for spending your time with me this evening, and I hope you've gained some valuable insights and practical tools to help you navigate menopause with confidence and clarity. Thank you.
All right, thank you so much, Julie. Some really valuable info there. And I think it really helps for people to realize that that what they're going through is a real thing that has basically, a definite kind of scientific basis to it, and that using the same approach that they may have used earlier in life may not work, as you said. So definitely a couple of really big keys there. So
Now I'm trying to unshare my screen. Oh, here we go. Stop share. Whoops. Escape. Stop share.
Okay, everyone. So I'd like to now introduce our second speaker. Anna Plešec is our main health coach at Lotus Holistic Medicine and is very passionate about women's hormones and how women can tailor their health to optimize their hormonal function. So passing over to Anna now.
Thank you. And thank you, Julie, for this in-depth, beautiful presentation on hormones. My name is Anna, and Sandeep, we can already go on the second slide if you don't mind. Yeah. As you can hear, I am originally from Central Europe, from a small, beautiful country named Slovenia. My journey with hormones started really young when I was in the beginning of my 20s. I was studying wellness, so I have a bachelor degree in wellness and spa management. But my hormonal symptoms guided me to study more in-depth nutrition, nutritional medicine, herbalism, and holistic health in general. And Sandeep, if you can go to the next slide.
Yeah.
So as I mentioned before, in my 20s, I have decided that I'm going to stop taking contraception pills, and I have been experiencing something that you might be experiencing right now in your 40s or 50s when you're going through the premenopause or menopause. So my gynecologist back then in Europe, when I stopped taking contraception pills, she diagnosed me as woman who is in her menopause. So as I mentioned, I have been without period for many years. I have developed many challenging symptoms, severe acne around my chin, my cheeks. I developed a thyroid dysfunction, and I was gaining weight even though I was really conscious already about the nutrition and everything because I started to study those things. And today, as Dr. Gupta mentioned, hormones and women's health in general is one of my greatest passion and something that I want to empower and share this knowledge with every woman because there is so many things that we can do at home on our own to support our overall health. And if we can go to the next slide. And I'm just wondering how many of you are at the moment, if you don't mind, maybe some of you just write down in the chat so that I can know how many of you is maybe in your 40s where you are going through these premenopausal symptoms, and how many of you are already experiencing menopause, so you don't have periods anymore. And I would also like to ask you or share this with you. Do you feel at this present moment in your life that you just don't feel like yourself anymore? Because when I completely lost my period and when my hormones were literally dropping, I didn't feel like myself anymore. And this would be one invitation from me to you today, that it is a really beautiful opportunity for all of us to rediscover ourselves. And as I mentioned at the beginning, I needed to start studying nutrition, Ayurveda, Chinese traditional medicine, herbalism in order for me to be able to discover what is actually happening inside of my body and how can I support myself. And me not feeling like myself guided me on the path of meditation and nervous system regulation, so I could at that time rediscover who I truly am. And I see that some of you are already writing that definitely not myself. Yes. And the first thing I want you to really hear today is that you're not broken and that your body is not broken. And that midlife is a time of significant hormonal changes. As Julie already mentioned, during premenopause and menopause, estrogen, progesterone, and testosterone begin to shift. And at the same time, stress hormones become often more dominant, or if I should rather say, more sensitive. So, especially in that time, we really have to be aware of our stress levels. And the changes, as Julie already said, that we can feel on the hormonal levels, of course, they're going to affect our metabolism, blood sugar regulation, mood, our energy levels, sleep quality, and our body composition in general. Okay, I'm just reading your comments in between. Okay, thank you for sharing that. And
Peter has her hand up as well, so maybe that just means that she's saying yes to your question.
okay, good. Thank you. The good news is that the more we understand those changes and the more that we acknowledge those changes, the more we can learn how to work with our body instead of against it. And we can absolutely thrive during this phase of life. And Sandeep, if you don't mind to go on another slide, that hormones don't work alone. And this is already something that Julie mentioned. It's never really just about hormones. So our hormones are not working against us, and they didn't just decided that, that they would just stop reproducing, but rather in holistic medicine, looking at the full picture of what is actually going on. And when we talk about integrative medicine, if you ask me, it's never just about the physicality of our body, even though, yes, if we measure, if we testing, we can definitely see significant changes in the levels of hormones. And yet, every phase of our life is inviting us to rediscover ourselves and to really look honestly in all areas of our lives to see what is actually working, what is actually not working for us. And one thing that when it comes to hormones, they do not work in isolation. They're constantly communicating with the nervous system and getting the information like, am I safe? Is there a threat? Can I relax? So communicating also with the blood sugar regulation, our sleep patterns, gut health is crucial when we talk about hormones, nutrition, movement, and even our environment. One thing, for example, in traditional Chinese medicine, which they are connecting all of our systems or inner organs through different elements in nature. For example, they would say that hormones are directly connected with the water element. And we know, for example, how moon is going to affect other waters on the planet when we are talking about the full moon, for example. And how those changes are also creating changes in our physical body with our internal state when our environment it's perhaps toxic, or in nowadays we are exposed to a lot of radiation, EMFs. It really impacts the way our hormones work with the quality of breath that we breathe, the quality of water that we drink, the nutrients, so nutrition, food, the quality of our food, and also the environment, like physical environment where we live in, and the quality of our relationship, which I'm going to talk a little bit more about it later on. So all of those biggest factors are affecting hormones today is also chronic stress. And on this another slide, I truly believe that this is the missing piece on this picture when it comes to hormones, or specifically if I am speaking through my own experience. Stress and nervous system is something that is going to be affecting the way our hormones work a lot. And specifically because our physical body actually cannot tell the difference between physical and emotional stress. For the body, stress is stress, and it's going to react pretty much the same. And we can experience work pressure, financial stress, relationship challenges, poor sleep, over-exercising, as Julie mentioned, chronic dieting, something that I hear from many women nowadays. A lot of women that I'm going to work with, a lot of the times they're going to share that they don't have breakfast, they're skipping lunches. Normally, they are going to be so exhausted by the end of the day that they're going to have a huge meal, maybe like an Italian kind of meal with a lot of carbs. So it's really something that I believe that when we work on all of those levels can make already significant changes in the way our hormones are going to respond. And the way our body responds is by activating cortisol, so stress hormones. And with cortisol and progesterone specifically, the study shows progesterone is one of the main hormones. Of course, all the hormones are going to be affected by cortisol, but progesterone specifically, when cortisol is up and really high, progesterone just goes away, says thank you, goodbye. And it's really important that we are aware of those things. And many women nowadays, they don't even know and they do not even realize anymore that they are functioning and working and functioning here during the day on the chronic stress levels. And when we have increases in cortisol and adrenaline, this all is going to reduce the hormonal resilience, and it's going to disrupt our sleep patterns and of course also recovery, and all this is going to increase inflammation. And if I speak from my own experience, probably one of the most sensitive systems and glands in my body, as I mentioned, hormones already, and thyroid. Thyroid, I have my light results showing in a specific periods of my life where I'm going to be, or I have been exposed to a lot of stress. This is the first gland that is going to be affected in my body. And it's really, awareness is a key to everything, so that we do know and understand our body, and that we know how to react and how to support ourselves when we are experiencing higher stress levels in our lives. Okay. A couple of practical things that I would like to share with you today that you can already start applying in order to start supporting your hormones. I'm highly encouraging you to start eating and including more protein in the diet. When I work with the clients, I'm always trying to invite every woman that her plate for breakfast, lunch, and dinner, it should have a good amount of protein. What kind of protein you already choose? For example, I like to start my mornings with eggs because the blood sugar levels, my hormones are the most happy and thriving when I have the most nutritious breakfast. So eggs, for example, one egg, again, probably it's a difference between the grams that we are going to have and how big it is, but one egg, for example, would have around 7 grams of protein. I would highly recommend to have between 20 to 30 grams of protein to start your day in order to support your hormones. And then for your lunch, dinner, for example, fish, chicken, yogurt, I normally recommend sheep's or goat's dairy because of the difference in protein. So protein A2 is easier to digest for most people, but yogurt in general is rich in probiotics, it's going to support your gut, and it's normally quite high in protein as well. And legumes, something that most people nowadays are really avoiding. But beans are amazing, and if we soak them overnight, if we pressure cook them, your body is going to be able to adapt, adjust, and digest this properly. Healthy fats. Our hormones are made of fat, so we have to be aware to be increasing good cholesterol levels and keep introducing good, specifically omega-3s in our diet. So making sure that with every meal, again, as I said before, having a good amount of protein, also have some small amount of fat. So olive oil, good quality olive oil, avocado, nuts, seeds, oily fish, for example. One category of the vegetables that I cannot highly recommend enough is cruciferous vegetables. Those are broccoli, kale, Brussels sprout, cabbage, and cauliflower. Those are the most studied vegetables, specifically broccoli, for example. It helps with any excess metabolism of estrogen. It supports liver health as well. So those are amazing vegetables that I would recommend having them on your plate every day. And polyphenols, so anything colorful. So colorful plants. I put a picture of berries here because berries are quite low in glycemic index. They are not going to be increasing your blood sugar levels. They are full of antioxidants. And this is something that is so easy to include. For example, if you have chia, with your chia snack maybe in the morning or later in the afternoon, is something berries, frozen berries is something that you should always have in your freezer. Then leafy greens, I love rocket, dandelion, any kind of lettuce is good. And fiber and hydration. So fiber, vegetables for our gut support, healthy grains, legumes, seeds, and plenty or filter of if you can get a good quality of spring water, that would be ideal to drink. And the key message of Nutritionist is to really build every meal around protein, healthy fats, and colorful plants, and of course also legumes and healthy carbs. I normally suggest gluten-free grains such as quinoa, buckwheat, millet. Those are really amazing grains that you can include when you have your lunch or dinner. We can go on the next slide. Another thing that I would like to just give a little bit more importance and intention to is blood sugar connection. And it's especially when we age, when we talk about the insulin, we really, what is creating inflammation in the bodies if we are keep creating spikes in the blood sugar. So that's why, for example, my body, if I would have the first thing in the morning, for example, oats with honey, with yogurt or some kind of granola, my blood sugar levels are really not happy with that. So normally, sometimes it's actually really good that we can measure blood sugar levels, that we actually have monitors on us for maybe a couple of days a week and see how our body is responding to different food. But mainly with women and what I have experienced and seen, that it's so important the first meal and how we start our day in order for how stable our blood sugar is going to be during the day. So starting the day with a protein-rich breakfast. This can be eggs, tempeh, tofu. Yes, you can have a good amount of yogurt. If I would have yogurt, I would always put some seeds and nuts and some good quality protein powder in it as well. We talked about already including protein, healthy fats, and fibers in every meal. And the studies are also showing that, especially in my part of the world, back in the days, the human analogy and idea was after the meal, you go and you lay down, right? But the studies are showing the opposite. After the meal, especially if we are eating more carbs, we should really go for a walk. Or sometimes I would suggest people, if you are lucky enough that you live in a household with the stairs, you just go up and down the stairs a couple of times so that you signal to your body, to your brain, that there is some energy needed and your body is going to starting to use as a fuel or excess carbs in your body. So that is one of the amazing things that we can do for a couple of minutes after our meals. And one of the things with blood sugar regulation is also to reduce ultra, I would not say just ultra, but any kind of processed foods and added sugars. And to have regular meals, so to not starve yourself and avoid skipping meals. Because as I said at the beginning, normally what's from my practice, what is showing me that normally when women are doing that, they're by the end of the day they're exhausted and they're going to be overeating later on, and normally things that are not that nutrition. And every meal is really opportunities to support your hormones, to stable blood sugar levels, and to create a stable hormonal environment. So Teresa is asking what good quality protein powder you would recommend. We have a couple of brands in Europe that you don't have here, but in Australia, for me, like what works for me is the raw protein brand, the fermented one. You can find it online or in the most chemist warehouse. It's just the way they are producing it. Also with other patients, so normally I would suggest pea protein. It's the easiest one to digest, even with cancer patients sometimes. Those would be the quality of protein that it's easier to digest. So Rule 1 is my number one brand, and I think the other one is Vital. And Sandeep, we can go on another slide. Just quickly, because I studied also herbalism, and I would say with everything else that I have done, herbs have definitely played a significant role in bringing my period back with everything else that I have done. And again, we cannot really be prescribing or sharing anything into details today because it's really so individual. But if anything, ashwagandha and rhodiola, two amazing adaptogenic herbs that works amazingly with the stress reduction and just support stress resilience and energy production in general. So I personally love those two herbs, ashwagandha, rhodiola specifically, because most of us as a women, we are constantly under stressors, different kind of stressors. So those herbs works amazingly. Shatavari, Dongquai, Vitex would be the next three ones, but again, those are so specific herbs that we have to know for what kind of conditions we are prescribing it for. Chamomile and lemon balm and passion flower would be something that it's safe to be taking in the evenings to calm down. Every evening, for example, I'm going to have a chamomile tea. My body loves it. It's part of my evening routine. And another tea, or rather herb, that I would recommend for every woman to drink on a daily basis is Tulsi tea. Organic India is my favorite brand for this. So I know that it's the way they are producing it, it's really pure, and their herbs still have a lot of nutrients in it. And we can go on another slide. So a couple of things before we finish that you can already start doing, and I do believe that many of those things you are already applying to your daily life. Morning sunlight to start increasing your healthy cortisol levels the first thing in the morning. So if you can, go for a short walk or even just to expose yourself to a sunlight, do a couple of stretches, a couple of breaths outside in nature first thing in the morning if you can. Then strength training, as Julie already shared about a lot. I'm a huge fan of that, but again, with a personal trainer and someone that knows and understands women hormones as well, definitely something that it's not that hard to apply once what you're doing and why you are doing. And nowadays, it just gives you not just resilience and the muscle growth and the bone support and all those healthy benefits, but it does something to your energetic body as well. It increases confidence. It actually also activates serotonin, like all feeling good hormones. So definitely lifting weights, strength training, and spending time in nature. So for example, one of the exercises that we are not really putting in the box of exercises, but walks are really underestimated of how much benefits we can actually get of daily walks in nature. Working on quality sleep and stress management and having full meaningful connection in our life. For women, tell that it's one of the, very much important things to have relationships that are actually meaningful and that are supporting our well-being. And just to finish again, knowing that your hormones are not broken, they're asking for support, and they're also asking us to grow. Hormones are always signaling something that is not working in our lives, and they're inviting us to grow and to expand and maybe to look into the things that we haven't been willing to look before. And especially in the later years, 30s and 50s and 60s, this is really the time, women, that I believe that it's a time of when women are stepping in their full power, in their full potential, where it's not anymore about how can I serve, how can I support, how can I over-deliver, but rather like how can I use this power and strength to create something that actually works for me, and how can I put myself first. And our hormones are going to keep inviting us to start looking in those directions. And three things that we can start doing probably tomorrow is to start increasing protein, especially when it comes to your breakfast and how you start your day. Eating around 25 to 30 grams of protein in the morning would be ideal. Getting morning sunlight, and create an evening wind down routine so that in the evening that you know that you signal to your brain, to your hormones, that it's time for you to start switching off and down already a couple of hours before you go to bed. And Sandeep, if you don't mind, just to share the PDF with the offer. So at Lotus, we have created something. So Julie, beautiful Julie, lives in beautiful Harvey Bay, and Julie came to Sunshine Coast, I think, oh my God, this time flies, but I think maybe half a year ago. We had a beautiful live event where we were talking about hormones for a couple of hours, and at that time we have created this amazing offer. I think it's amazing for every woman who really wants to go deep and really balance her hormones. It's a 6-month program where you would be seeing Julie and myself. So 4 coaching sessions for 60 minutes are included. Free body composition scan, which we actually can see how are your body, the bone density, body muscle, the water in your body, that we have an understanding what is actually happening on the physical body and how can we support it more. And you have 2 30 minutes phone consultation with Julie, which you already explained. She's going to prescribe and can do some blood refers and already start you on a specific treatment therapies uniquely designed for your body needs. And a 6-month program for all that included is $150 a month. And if you would like to book, for example, a discovery call or have more questions, you can email us on admin@lotusholisticmedicine.com.au. I'm hoping that this was that you were able to receive something from that presentations, and that you're going to be able to apply maybe some of the suggestions that Judy and I have represented today. I think we could speak for hours and hours about hormones, but just to get an idea about what can we already do at home. So if anyone...
So if anyone has any questions, go ahead and pop them in the questions and answer pane. So there was ones there. Someone was asking that can't understand what you said your favorite herb was.
Oh, probably Tulsi tea.
Tulsi. Tulsi. It's Indian basil.
Yeah.
There we go.
Oh, I think I just sent it to you, Sandeep, instead.
Okay, that's all right. I'll put it in.
I did it already. Okay. So yeah, go and buy some Tulsi tea.
Everyone comment Tulsi.
We will send you a free tea bag.
Comment Tulsi for a free tea bag. I like it. I like it.
Maybe next time.
Well,
We will serve you Tulsi tea when you come to the clinic.
definitely. Definitely right. Any more questions, folks?
Oh, you're drinking it now. I'm glad.
Excellent. Quick question. When would you recommend, Anna, that women would go on herbs versus starting bioidentical hormones?
I think that's a hard question to answer because it really depends on how significant and severe the symptoms are. But for example, for younger generation, specifically, for example, teenagers or early in 20s, I'm not saying that HRT is not appropriate at that time. I'm just saying that I have seen some significant changes just through managing the blood sugar level, the nutrition, and herbs. So Shatavari Donkwai White specifically is one of the most amazing one that I know for young women specifically. It works amazingly well.
No, great. What else do you guys specialize in other than hormones? Marta is asking.
So I work a lot on the mindset and nervous system regulation as well. And next to the hormones, I'm really passionate about gut health. And because I work in a Lotus Holistic Medicine with amazing Dr. Gupta, I do have knowledge and understanding of chronic conditions such as mold, for example, because we do see a lot of patients that have significant mold-related illnesses.
Right, and Julie, would you like to share about what else you focus on?
Sure. So I would say nearly a third of my women are really struggling with weight. And that's the other thing that I tend to tie in with the hormones. I guess I'm, got a fairly narrow focus. Yes, I am integratively and functionally trained, but they're the problems that usually people come to me with is weight and then the hormones. So we do a lot around that, medical weight loss programs if that's what's needed, or just working alongside, balancing insulin, blood sugar levels. A lot of doctors don't test fasting insulin, so that can be a bit of a clue that's happening in the background. So I always check that. Yeah.
Okay. And can you explain what's meant by bioidentical hormones, Julie?
So there is a bit of semantics at the moment. You'll hear some people say, oh, you've got to call it body identical. Body identical is the real word, but they do mean the same thing. If you put bioidentical and body identical into Google, what do they mean? It's the same thing. So yes, all hormones are made in a laboratory. There's no such thing as, natural hormones as such. But bioidentical or body identical means that the molecules, so estrogen, progesterone, testosterone, the molecules that are used to make the products they match exactly our molecules. So if we were to prescribe something synthetic, like a synthetic progesterone, which I never do, I just think Dr. Dash will call them monster molecules. The molecule looks very much the same, but with an added something on it so that it can be patented, so that it can be sold as a drug. So they will lock into or onto a receptor, but not quite fit. It's like a lock and key that gets jammed. So they might provide some protection or some benefits, but usually you don't get the beautiful effects of calming and sleep. And they just work very differently. Does that help?
Yeah, absolutely. So and basically then you don't tend to get unexpected results as much, is that right? Because they're working like the hormones that are native in our body. Or sometimes the other ones can give you paradoxical actions.
And of course, we're not trying to put your hormones back at a level where you're in your 20s or 30s, but we just want enough to support your bones and your brain and make sure we're not developing osteoporosis and heart disease, all those things that creeps that in the pause.
Great, thank you. I might also ask Anna, do you still take new clients?
Yeah, so we actually started to taking new clients, and Dr. Gupta is again able to see people. We are taking people on a 6-month journey. So for everyone new that would want to register or see us, we are asking people to commit for at least 6 months in order for us to be able to support you and to deliver some significant changes. But yes, you can go on our website, Lotus Holistic Medicine, and you will see at the beginning on the homepage, you will have an Inquire Now button. So if you press there, you can fill up the new patient inquiry form, and we will be in contact with you. Yes. Brooke is asking regarding the pea protein recommended is not good for thyroid condition. So I guess, it depends. For me and most of my clients, I think pea protein, again, it depends of what kind of pea protein quality are you able to get on the market and how your body is behaving when you're having it. Hemp protein is something else that you could try, or whey protein. We have a good whey protein powder from Premier Research. I know that Dr. Gupta really loves that one. But Sandeep, would you say that did you find any medical research when it comes to pea protein and thyroid condition?
Well, there's various goitrogens, which means that there's various foods that can tend to promote goiter or enlargement, the thyroid, and that tends to be more the cruciferous vegetables and then soy, particularly if you're low in iodine. So so then maybe there's a tiny bit of effect of the pea, but I don't think that's one of the top ones that are included on that list. So it would more be the cruciferous vegetables, especially having them in the raw state, apparently.
Yeah, not so much instinct.
And then soy. Yeah, and it tends to particularly be a problem if you're kind of low or borderline in iodine. So you want to make sure your body is quite sufficient in iodine. I'm testing a lot of people and finding that they are, majority of people are low. So I think that's another important thing to prevent goitrogens from affecting you a lot. Okay, so the next question from Brooke was, does your clinic work with CGMs? I can talk about it if you want. So yeah, so CGMs means continuous glucose monitors. Usually what they are is like a device that's implanted into your upper arm, and it has a tiny little needle. It doesn't really hurt. And then what it's doing is continuously taking capillary blood and measuring the glucose levels, and therefore you get like a graph throughout the day. So if you're extremely sensitive to EMF, we don't necessarily recommend it because there will be a little bit of EMF involved. However, it can be very revealing, because in my case, I found there were certain foods that make me jump over 10. And that wouldn't be expected. So normal blood sugar should generally be between 5 and 7 a lot of the time. I guess it can go a little above that with meals, but not much. You want it to generally stay pretty tightly regulated in that. So if you're jumping above 10 like I did after eating rice, you can then conclude that I should probably not eat rice. So that's where it can tend to be useful. And I guess I was also able to work out what eating pattern allowed me to stay in that sort of ideal blood glucose range the vast majority of times. And it was, in my case, it was actually without any grains. Many people do find that. So for that purpose, I guess individualizing your diet to yourself, I think it is well worth doing.
Yeah. Yeah, and actually testing and trying what works and how your body is able to digest it. So Brooke said that fermented brown rice protein. So the raw protein brand that I mentioned before, they are fermenting everything. Mainly they're using pea and brown rice, yes. So that's good that that's working for you. And Kate, yes, we definitely support patients who are plant-based as well.
Yeah, some studies have found that rice protein is quite high in heavy metals.
Again, and
I
then,
actually,
yeah,
maybe I'm a tiny
arsenic.
bit different. I tend to try and avoid rice protein as an option. So Marta said she finds pea protein a bit hard to digest, being on a low FODMAP diet, which is fair enough. iPhone says that my weight dropped off at menopause, so I didn't realize that iPhones had menopause. And so I am the same weight I was at 19 years old. My hair is dry and thin. and I feel grumpy most of the time. Would hormones help? I eat very well. Maybe I'll pass that on to Julie. So weight
Absolutely.
loss.
Oh, yeah. So you're saying you actually lost weight, which is quite unusual for people to lose weight at menopause. Yes, the hair, but the dry hair can be very much, it's more of a hormonal shift, but that grumpiness, a lot of women are just transforming their mood when they start on hormones. Progesterone especially is very good for
Yeah.
mood.
Yeah, that's very, very important. All right, some really good questions there, guys. So thanks for joining this webinar today, and I really hope you've got some good info out of this. And once again, if you're looking to kind of get a bit more support on hormones, contact us for a discovery call, and usually we'll get 15 minutes or 20 minutes of Anna. And so you can book in just by emailing us at admin@lotusholisticmedicine.com.au. All right, guys. Oh, any last questions here? I think one just popped up. Okay, thanks for the webinar. Now to the origin. Very good. Now, do you know what the origin is, Anna?
Some this show, right?
No, it's football, state of origin. It's rugby. So Queensland versus New South Wales.
Okay, maybe I have to get more educated about that if I'm already living here, right?
Good words on a Wednesday night.
Yeah, that's right. All right, everyone. Thanks to Anna and Julie.
Thank
Appreciate
you.
it. Alrighty. Good night.
Bye.